Having a school-based health center is tremendous for the kids.
It's a great place to make an impact, even if it's just with one adolescent.
The health center helps give them guidance, show them ways to protect themselves, and prevent certain diseases from happening.
Each time when we make a difference for a youth, I believe this is a success.
The School Community Health Alliance of Michigan represents and supports over 50 school-based health centers located in urban, suburban, and rural areas across the state. These centers are strategically located to serve low-income children and families, as well as communities that are medically underserved.
We're taking care of you today.
It's hard enough being an adolescent. I see kids doing their best when they feel their best.
School-based health centers promote the health of children, adolescents, and their families by providing important primary, preventative, and early intervention services. Housed in elementary, junior, and senior high schools, centers are capable of providing comprehensive care to over 100,000 children throughout Michigan. By serving children from kindergarten through high school, school-based health centers have the opportunity to establish a continuity of care that is critical for child development.
Sometimes people go, oh, you're just a school nurse. Our role is very unique in that it's an independent center attached to a school. But it's a full-service clinic. We do laboratory testing, diagnosis and treatment, write prescriptions, immunizations, everything necessary that they would need in a primary care provider's office.
It's really cool to have it just right in our school. So if we get sick, our parents don't have to schedule a doctor's appointment for us.
We just find that clients are really satisfied with our services. We have a great return rate. Clients come back, they feel like it's a friendly atmosphere, and they really are able to get the services that they need.
I get this clean, you know, and nice people. They easy to talk to them about anything. Like some people try to make decisions for you or judge you. They don't do that, you know.
By focusing on individual children and their families, school-based health centers increase student performance, reduce attendance problems, and decrease school violence. School-based health centers remove physical and emotional barriers to learning, helping to keep students in school.
You know, help folks get a chance to zero in on academics and also get away from, misbehaving, those kind of things, and other health issues that, can hinder progress.
At the heart of each school-based health center are parents, school administrators, and medical professionals working together. Driven by this collaborative relationship, each health center is able to provide a wide range of services designed to meet the needs of children and the community as a whole.
We work like a team. Okay, the director of the health center and I worked in tandem to try to work through problems and solutions, and it worked out pretty well.
We have a community advisory board made up of people from a lot of different sectors.
It just seemed like a good program to me. So I decided I wanted to be involved.
They were kind of like my helper and a friend to my kids and a support to our whole family.
It is real current as to some of the things that our kids are going through here.
The office stocks our forms, so any new student that comes in, they make sure that that is part of the school packet that they have to fill out in addition to whatever school forms. So we get that back. We work with all the staff. We're in their classrooms on a regular basis, running programs. We're in the halls.
Beyond primary preventive care, many school-based health centers also provide services such as comprehensive health assessment, vision and hearing screening, medication, immunization, treatment of acute illness, co-management of chronic illness, and mental health care.
We carry many programs because we kind of complete the school system.
It's a combination of attending to whatever clinical needs they may have, as well as trying to impart good health instruction, give them skills that will carry them for the rest of their lives.
Nutrition, healthy diet,
hypertension and diabetes,
asthma prevention.
We run a violence prevention program. We run an abstinence program.
Besides providing medical services, to provide social work services.
To build that relation with the youth, you have to spend time with them. You need to build the trust.
And I come down here sometimes when I don't feel, I feel down or something. they'll talk to me about it, then I won't feel so bad.
Things the students bring them, I won't be able to do it. I ain't gonna tell you a story, but they have such a compassionate heart.
They look you in the eyes, they talk to you like an adult, which I always appreciated.
You meet people, you talk, you get to know them, they become like family.
It provides you access to a population that's very hard to gain access to by putting you right there where they are.
And that's significant for their educational outcomes, it's significant for their community outcomes, it's significant for reduction in problems, as well as enhancing the capacity of kids to learn.
School-based health centers make high-quality care broadly accessible to members of their communities.
We bill on sliding fee schedule, and it's our mission to see those living in the community that nobody's turned away for inability to pay.
And it doesn't get any better than that as far as I'm concerned, as far as health care, and being able to actually service people.
With adequate funding, school-based health centers are able to overcome barriers to health care for underserved children, as well as reduce health-related costs to the state.
It's real cost-effective to invest in prevention activities with these teens.
You've got a model that's nurse practitioner driven with physician oversight and managed care connection, so it's the cheapest way to deliver care.
The services offered by school-based health centers are supported financially through state and federal grants, as well as through local funds and private contributions. Although the Michigan Department of Community Health and Michigan Department of Education provide critical funding for school-based health centers, it is important that centers continue to elicit a stable and diverse funding stream to support the essential services that are provided to children and their families.
That money from MDCH can only go so far, so it's good to be able to have other resources.
And so we're funded not only through the state association, but also we have a fiduciary of Oakwood Hospital.
Funding from Michigan AIDS Fund, who gives us money to do the HIV testing and education, and then we also applied to get funding from another foundation that covered medical supplies and lab costs.
There's a lot of donors and a lot of supporters, and we're very grateful for that.
All Michigan children and youth have a fundamental right to access and receive comprehensive primary health care and prevention services. By providing these services at low cost within a school setting, school-based health centers strengthen the children, families, and communities they serve.
If you do not have good health care, then you're going to fall behind.
Kids don't tend to go see doctors or go to health clinics. But when you have a presence in a school like this, they do come.
And where there's a partnership between the school and the community, it's the best solution most communities have to take care of all of that in one efficient partnership.
And we are able to do a lot, and we are helping, but we feel we can do more.
It's been a blessing to our school just to have them in there, and I think down the line we'll probably do a lot more because we understand each other and we have common goals.